is anchored on the principle of democracy that says that it is the will of the people, by the people, and for the people, and must always prevail. Many of you will know that the processes towards opening of this clinic have been very long and very difficult, including the specific demand that the community made on government that this clinic must not only just become a primary health care center or primary health care clinic, but it must also offer emergency services 24 hours. While there has been many differences, many of you would know how many meetings we have had, and caucused with the city councillors, and how there was some point where the valve of water got lost when we were just close to opening the clinic. But I think we must also welcome from our side, I think we must not shy away from the fact that we are very thankful that the ANC is back in power in Johannesburg.
Yes.
It was a very difficult journey. Opening this clinic, the journey was very clear that it needed the ANC to be in power. Yes. Because there are some people who've got ideas that don't really make sense in many instances. So we need to be important and say that very openly and blatantly, so it must not be said that we gossiped. It's not a gossip. It's good that the ANC is back in power. The opening of this clinic also has got very bad memories for most of us. Maybe we must talk about it, Madam Speaker, that maybe we should name it after our story. Because it will symbolize the pain that we went through when government changed in Johannesburg. Whilst there have been many differences, we appreciate the fact that the work that has been done by both the officials of the city and the department to make sure that we realize this partnership. It is important to realize that the Constitution of South Africa reigns supreme, that the province has got the custody of running emergency services and the 24-hour service, and that the city has got the custody of running primary health care. But it's good that the partnership that were formed will make it a proper integrated service for the people of Greater Ivory. The second important lesson that we learned from this launch of this clinic today, as members of the community and citizens of Gauteng, it is critical that we exercise our democratic right to vote for the government of our choice. Yes. You must not make mistakes as you did in the past. Yes. We must make sure that we keep those who've got the interest of our people of moving the country and moving the continent forward. As leaders and government departments, we are bound to implement the National Development Plan Vision 2030, which on health priorities, it instructs us that we must fight to increase the life expectancy of our people. We must progressively improve our TB prevention and HIV and AIDS treatment and cure. We must progressively reduce maternal and child mortality and reduce prevalence of non-communicable diseases. But it's also important that the National Development Plan says that we must reform the healthcare systems and strengthen primary health care and also achieve universal health coverage. In order to achieve the following goals, we have set as a country and as a province an important focus on community health care centers. When we talk about community health centers, we talk about clinics that will run 24 hours. Currently in the province, we've got 33 when we add this one. We are hoping that by the end of our term, we would have reached at least 45. But I'm certain that by the end of the next financial year, we would have at least have opened 40 clinics, which are 24 hours across the province. Johannesburg would have contributed, because this is a model, would have contributed at least 3 or 4 of them moving forward. So it's important to know. So we are very proud that we are opening the Ebony Park CHC today. Therefore, it shows us that as a department we are seriously implementing the NDP, and we are seriously in making sure that we improve the lives of our people in Gauteng. It is our belief and hope that running of this clinic will, in a number of ways, uplift the quality of life of the people in the area, and it will also improve the quality of access to the care of our people. We normally argue in Gauteng that access is not really a problem. The problem becomes the quality of the service that we give. Recognizing that the demand for the healthcare in the area had significantly increased over the years of the area. When the area started in 2009, it had almost 35,000 people, and now we are talking about over 70,000 people that stay around the area. So the inadequate infrastructure and the demand of the clinical service necessitated us to be able to expand the service care of this clinic. This event therefore celebrates the overall achievements realized by building of a new clinic that has been converted to a CHC. It renders a 24-hour midwife ran obstetric unit, accident and emergency services, and it also caters for an X-ray in future, 24 hours. It will be installed and it will be working. We're also making sure that there will be laboratory services that will be offered, so that you don't get to transfer to Tembisa just to go and do blood tests. And also we want a 24-hour pharmacy which is already there, which will offer you medicines after you've been seen. As a contribution to the establishment of health precinct on this region, Ebony Park project is one of the capital projects in the province, has over years received investment of over 50 million, which has been used for the building of the clinic. It has got 18 consulting rooms, and it features all the feats of the ideal clinic. And it has also got an accommodated MOU inside, and it also has got a very big and sizable casualty, which will offer the services of excellence. The clinic already, as I worked here, I think we had our first born baby on the 30th at 7:30 in the morning last time. And up to now, we have delivered close to 55 babies. So I'm one of those who didn't want to come. I think I asked the executive mayor and the MMC that it's important that we allow the clinic to run before we come and celebrate. Because it will be difficult to open a clinic that has not worked. So I came also myself last night just to make sure that things are in place and it is running. At least I did remember a bit of my medicine going forward, but I'm hoping that the clinic will help us get further. The clinic provides and continues to offer comprehensive, preventive, and curative health services. We also include our prevention in the fight against HIV and TB and other related diseases. The Gauteng Department of Health has got a priority of health promotion and health education. So the opening of the clinic will strengthen that aspect of health education and health promotion. It will help us to improve the community knowledge about diseases. It will help us to prevent onset of disease. It will also help us to screen undiagnosed diseases. And it will also help us to control the disease, and particularly those that are preventable. In preparation for the